Imagine waking up with your heart racing, hands trembling, and body overheating, yet everything around you seems normal. You're anxious, can't sleep, and losing weight despite eating more. It might seem like stress, but it could be hyperthyroidism, a condition that silently speeds up your entire system. Often overlooked, hyperthyroidism affects millions and can severely impact your heart, bones, and mental health if left untreated. In this video from Palm Health, we'll explain what hyperthyroidism is, its causes, symptoms, how it's diagnosed, and the treatments that can help you take back control. Let's dive in. What is hyperthyroidism? Hyperthyroidism, commonly referred to as an overactive thyroid, is a medical condition in which the thyroid gland produces and releases more thyroid hormones than the body needs. The thyroid gland is a small, butterfly-shaped organ located at the front of the neck, just below the Adam's apple. Despite its size, the thyroid has a massive influence over your body's metabolism, the rate at which your body uses energy. The two main hormones produced by the thyroid are thyroxine, T4, and triiodothyronine, T3. These hormones control how quickly your body burns calories, how fast your heart beats, how your digestive system functions, and even how your brain develops and operates. In hyperthyroidism, the thyroid releases too much T3 and/or T4 into the bloodstream. This causes the body's metabolic processes to speed up significantly, leading to a wide range of physical and emotional symptoms that can seriously impact quality of life. Symptoms of hyperthyroidism. The symptoms of hyperthyroidism can vary widely from person to person. Some individuals may only experience mild issues, while others may suffer from severe and life-altering problems. Because the condition speeds up many of the body's natural functions, most symptoms are related to overactivity. Common symptoms include weight loss even with an increased appetite, rapid or irregular heartbeat, palpitations, nervousness, anxiety or irritability, tremors, especially in the hands and fingers, heat intolerance and increased sweating, frequent bowel movements or diarrhea, insomnia or difficulty staying asleep, fatigue or muscle weakness, thinning of the skin or brittle hair, menstrual irregularities in women, increased sensitivity to heat. Some people may also develop a goiter, which is a visible swelling at the base of the neck caused by an enlarged thyroid gland. In cases where Graves' disease is the cause, the eyes may also become inflamed, bulging, or irritated. This is known as Graves' ophthalmopathy. The symptoms often build gradually, but can sometimes appear suddenly and be mistaken for anxiety or stress. That's why it's essential not to dismiss these signs, especially if several of them are happening at once. Causes of hyperthyroidism. Hyperthyroidism can have several causes, but the most common by far is Graves' disease, which accounts for up to 80% of all cases. Let's break down the primary causes. 1. Graves' disease. This is an autoimmune disorder in which the body's immune system attacks the thyroid gland, causing it to produce excessive hormones. It's more common in women and often runs in families. One hallmark of Graves' disease is the bulging of the eyes, which can be painful and affect vision. 2. Thyroid nodules, toxic nodular goiter. These are non-cancerous lumps that form on the thyroid gland. In some cases, these nodules begin producing thyroid hormones on their own, independent of the body's regulation system, leading to hormone overproduction. This form is more common in older adults. 3. Thyroiditis. This is the inflammation of the thyroid gland, which can cause stored thyroid hormone to leak out into the bloodstream. It may result from viral infections, autoimmune conditions, or even after childbirth, known as postpartum thyroiditis. This type of hyperthyroidism is usually temporary. 4. Excessive iodine or medications. Too much iodine, either from diet or medications, can also trigger hyperthyroidism, particularly in people with pre-existing thyroid disorders. Similarly, taking too much synthetic thyroid hormone used to treat hypothyroidism can tip the balance and lead to hyperthyroid symptoms. 5. Functional thyroid tumors. In rare cases, benign tumors in the pituitary gland or ovaries can produce hormones that affect thyroid function and cause overproduction. Identifying the underlying cause of hyperthyroidism is crucial because treatment options vary depending on the origin of the problem. Diagnosis of hyperthyroidism. If you're experiencing symptoms of hyperthyroidism, your doctor will begin with a detailed medical history and physical examination. This is followed by a series of thyroid-specific blood tests that check hormone levels. Here are the main tests used. TSH, thyroid-stimulating hormone. This hormone is produced by the pituitary gland and stimulates the thyroid to release T3 and T4. In hyperthyroidism, TSH levels are typically very low due to negative feedback. Free T4, thyroxine, and free T3, triiodothyronine. These are the actual thyroid hormones in your blood. In hyperthyroidism, T3 and/or T4 levels are elevated. Thyroid antibodies test. This test checks for antibodies that might indicate autoimmune conditions like Graves' disease. Radioactive iodine uptake, RIAIU. This imaging test measures how much iodine your thyroid absorbs from your bloodstream. It helps determine if the gland is overactive and points to the specific cause. In some cases, thyroid ultrasound or thyroid scan may be done to check for nodules or irregular gland structure. Treatment options. The good news is that hyperthyroidism is highly treatable, though the path to balance depends on the cause, severity, and patient's age or medical condition. 1. Antithyroid medications. Drugs like methimazole and propylthiouracil, PTU, reduce the thyroid's ability to produce hormones. These are often the first line of treatment, especially for younger patients or those with mild symptoms. Methimazole is preferred due to fewer side effects. PTU is typically reserved for pregnant women or those with allergies to methimazole. It can take weeks to months for hormone levels to normalize, and regular blood tests are necessary to monitor progress. 2. Beta blockers. These don't treat the hormone imbalance but help manage symptoms such as rapid heartbeat, tremors, and anxiety. Common beta blockers include propranolol and atenolol. 3. Radioactive iodine therapy. This involves taking a pill or liquid that contains radioactive iodine, which is absorbed by the thyroid and destroys overactive cells. It's one of the most common treatments in the US and typically leads to hypothyroidism, which then requires lifelong hormone replacement. While it's effective and non-invasive, it may not be suitable for pregnant or breastfeeding women. 4. Surgery, thyroidectomy. Surgical removal of all or part of the thyroid is an option in certain cases, such as severe goiter causing breathing, swallowing issues, patients who cannot tolerate medications, those with suspicious nodules or cancer risk. After surgery, patients will also require lifelong levothyroxine therapy to replace missing hormones. Living with hyperthyroidism. Managing hyperthyroidism is not just about medication, it's about long-term monitoring and lifestyle balance. Regular follow-ups are necessary to adjust medication and monitor hormone levels. Avoiding excessive iodine, such as certain supplements or high iodine foods, is often recommended. A healthy diet, regular exercise, and stress management can help manage the symptoms and promote overall well-being. Patients treated with radioactive iodine or surgery will need lifelong synthetic hormone therapy and should be aware of signs of hypothyroidism. which can sometimes occur as a side effect. Pregnancy, aging, and other conditions can alter thyroid needs, so staying connected with your endocrinologist is essential. Hyperthyroidism may seem overwhelming, but with the right knowledge, it's manageable. Recognizing symptoms early, like weight loss, anxiety, or a rapid heartbeat, can help prevent serious complications. If this video helped you, don't forget to like, share, and subscribe to Palm Health for more clear, reliable health info. Stay healthy, stay informed, and see you in the next one.